The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for participating in today's webinar on patient reminder notifications, hosted today by ClientTell and Jeff Ellis. I want to let everyone know that you are in mute status only. So if you have any questions, please type in your questions in the questions tab, and we'll be sure to answer your questions at the end of the webinar. I would like to get started by sharing a couple of poll questions and asking you to take a few seconds to answer them for us. And here we go. You should see that on your screen. I'll give you a few more seconds there. Okay, we'll go ahead and jump into the second question. And there you go. You should see the new question on your screen. Give you about another 5 seconds there to answer. Okay, we'll go ahead and close the poll questions. I'd like to introduce Jeff Ellis. Jeff Ellis has spent the last 10 years helping healthcare providers streamline their practices operations by automating routine provider-to-patient communications. Through the use of automated voice, text, email, and smartphone push notifications, Jeff has helped practices reduce their missed appointments by 20% on average and helped collect millions in outstanding patient balances. I'd like to hand it over to Jeff. Jeff, are you there?
I am.
Okay, it looks like we lost the PowerPoint.
Okay, let me go ahead and share that again.
There we go. Thank you.
Okay. All right, perfect. All right, so Veronica, I appreciate the introduction there. Again, my name is Jeff Ellis. I'm a Director of Business Development for ClientTell. And I have a few slides for you here just to introduce to you the company ClientTell, who we are, what we do, and also talk through how we can help your practice through automated patient messaging. And so just by way of introduction, our company, ClientTell, we are headquartered in Valdosta, Georgia, and today we serve over 90,000 healthcare providers through our automated patient messaging services. And the clients that we serve, they represent practices of all sizes, practices down to single provider practices. We have some clients that see less than 10 patients per day, all the way up to some of the largest hospitals and health systems across the country. And the way that we've been able to scale to such a great degree is that our product, Reminder Manager, is a fully hosted service. So when you use the solution, you don't have to install any new servers or manage phone lines or anything like that. We just work through with your current scheduling system and any internet connection that you have. And then you can take advantage of our platform to send automated voice, text, email, or smartphone push notifications as reminders down to your patients. And our company, and really what this presentation is really focused on, is appointment reminders. But keep in the back of your mind that our solution can be used for any type of messaging, everything from collection-related messaging to recalls and follow-ups to remind patients who are due for appointments but are not already on the calendar to come in, all the way to emergency closings. Maybe if you have inclement weather or if a doctor gets sick and you have to close for the day. Our system can really send any type of patient notification, just so long as we're not including any sort of protected health information in those messages. Now, how it works. So again, whenever you sign up for Reminder Manager, you have access to send messages through all 4 channels that we have: voice, text, email, and push notifications through our smartphone app. And the way that we generate those messages is that we connect with your scheduling system, and we extract the upcoming appointment data that we need to generate the messages. And that scheduled data is securely transferred to our data center, and where we house information about when to send the messages. Maybe we're calling 2 days prior to the appointment, and maybe we're following up with a text message the day before the appointment. Or perhaps you're capturing the patient's preferred method of contact, and we're just sending the appropriate message down to the patient based on their preference. But we send those messages, and then the patients have a chance to interact with them, and then we provide a detailed report back to your practice to show you how each and every message was handled. Now, this is an example of what a relatively straightforward appointment reminder voice message script might look like. And a few things to note about the voice messaging that ClientTell sends. So everything that you see here, so all of the elements, the verbiage that you see, both in black and in red, all of the components of the message are pre-recorded by our professional voice talent that we have on staff. So whenever we send out a message, it doesn't sound like a robotic, machine speaking to the patient. It's going to be a high-quality pre-recorded message recorded by our professional voice talent in our sound booths. And the lettering that you see here in black is what we refer to as the template portion of the message, and the red elements are what we refer to as variable elements. So the template portion of the message will generally stay the same from message to message during a specific messaging session. So if for one day you have 25 appointment reminders to send through voice, this template will generally stay the same through those 25 messages. But these red elements, these variable elements, could change from message to message based on the different data elements related to that appointment. So in this case, we are giving the location for the appointment, so Westside Medical Center, along with the date, the time, and the patient's first name. This could easily say the doctor's name as well. So it might say, this is Dr. Jones or Dr. Stevens, just depending on which Dr. Ryan is coming in to see. But keeping in mind that it's all dynamic. So based on the data that we receive from your scheduling system, we're going to merge those elements in, and then whenever we send the message out, it's going to sound customized for that particular patient. And all of that is really geared towards getting the patient to the point where they interact with the message. So in the case of an appointment reminder, we're primarily trying to get them to confirm their appointment, ideally, or perhaps we're giving them an option to repeat their appointment. We can even give the patients the ability to cancel their appointment over the phone. Not everyone uses this, and you don't have to add this option, but it is available for you there if you want to give patients that ability. Patients also could be given the ability to be transferred back to your practice for certain scenarios, perhaps if they need to reschedule their appointment or if they have questions associated with the appointment they're coming in for. One of the unique features about our voice messaging is that just like you see the merge elements here within the message, we could even merge in additional elements, entire components of the message based on the type of appointment the patient is coming in for. So if you wanted to let Ryan know, remind Ryan not to eat or drink anything after midnight prior to his appointment, we could actually customize this message so that whenever we see that type of appointment coming in, that appointment ID or that appointment type, we can add that specific message element, that trailer to the message to go out just based on those rules we put in place for your account. So key things to note there, all of the messages that we send out through voice are recorded by our professional voice talent, and they're very customizable based on the rules that we have in place for your account. Now, once we've sent those voice reminders, patients have the ability to interact and respond to those messages, and there are about 36 different statuses that could potentially come back. Everything from, did we get a confirmation of the appointment or a cancellation if that option was given, all the way down to, did we leave a message on the patient's answering machine or get a busy or an out-of-order number. One nice thing about the ClientTell service is that whenever we reach a busy signal or a no answer or any scenario or any status where we don't actually connect with the patient's phone line, there is no charge for that attempt to call the patient. We only charge for voice calls where we actually connect with the patient's phone line. So it's a very efficient system for you. Also, if we do get a busy signal, we will actually retry that busy number up to 10 times during a specific messaging session before we give up and report it as busy. So again, it's a very efficient service for the practice there. Now, these are some examples of what our text appointment reminders could look like. And just like the content of the voice messages, the content of the text messages is completely customizable for your practice as well. And again, there's no additional charge for that. That's just a standard part of the service. And you can see here in this example, we're delivering a lot of the same information that we would deliver in the voice call, like the location of the appointment, and in this case, the provider's name associated with the appointment, along with the date and time. And then we're prompting the patient to reply with an OK to confirm their appointment. And whenever you see here, whenever the patient does reply with that OK, we give a little confirmation back to let the patient know that their appointment has been confirmed. Again, one of the important things to note about our text messaging is that whenever we send a text message, we only charge for this initial text message that we send. There's no charge for the patient responding or for the additional message that we send, letting the patient know that their appointment has been confirmed. Also, and this is just an example of what another text reminder script might look like. In this case, the option to cancel the appointment is included in the text as well. But again, a key thing to note here, you can do anything you want to with the content of the message, just so long as you're not including any sort of protected health information in what's being sent out. And whenever a patient confirms or gives you feedback through this text messaging reminder, these results go back, reported to the same channel, the same place that the voice responses are reported to. So you don't have to log into separate areas or look at separate locations to view the responses for text or email. Now, these are some examples of what our email notifications could look like. As you can see, they could be text-based or they could be full-on designed, graphical-based HTML emails. And the HTML emails, we could mimic your website, or we could include any sort of HTML template that you wanted to use. The option is really up to you. Again, there's no charge for setting up this HTML-based email. That's, again, just a standard part of the service. And the content, once again, is completely customizable. Our staff will help you script out these messages, but you can say anything that you want to say here, again, as long as there's no PHI included. And just like in the voice and the text reminders, patients have the ability to confirm their appointments through the email, or you can give them a cancellation option as well. So in either scenario here, patients can give you feedback about whether or not they're going to come to your appointment. Now, the fourth channel that we have to send reminders is through our smartphone app. And the smartphone app is free for patients to download to their iOS or Android device. And once they've downloaded the app, they're presented with a screen where they will be asked to enter a unique facility code along with their first name, last name, and the phone number that you have on file for them. Now, this facility code is uniquely assigned to your practice whenever you sign up for the service. And the reason why that's there is because the patient could potentially have other facilities that they're getting notifications for within the app. So they could potentially get reminders for their dental appointments, their cardiology appointments, and their family practitioner, all within this single app, just so long as those facilities are also using the Reminder Manager service. So they enter those 4 pieces of information and click Save. Now, whenever they make the attempt to save the new facility, we do some verification on our side just to make sure that the person who submitted the information is actually a patient of your practice. And once that's verified, then the patient can begin to receive new push notifications through the Reminder Manager app. And this is an example of what a push notification would look like. As you can see here, it's a very generic message, not giving away any sort of purpose for the visit or anything of that nature. And very similar to the Mail app, the Reminder Manager app shows the number of unread messages that are available for the patient to view. When the patient drills down on the Reminder Manager app, they can see any past appointment reminders and see the details there, or any new reminders where they can click, drill down, and again, very similar to the other channels that we have, they can see the location for the appointment, potentially the doctor's name, along with the date and time of the appointment. And again, very similar to the voice calls, any sort of special note that you might want to include based on that appointment. In this case, it just says, please arrive on time, but it could just as easily say, something along the lines of, please remember not to eat or drink anything after midnight prior to your appointment. Any special details that you want to deliver there. Then the patient is prompted to confirm their appointment by clicking the big red button here in the middle. And when they do that, it turns green, shows that the appointment has been confirmed, and then the patient has the ability to add the appointment to their calendar, or call the practice if they have any questions, or even get driving directions through their native Maps application if they're coming from an area across town or an area they're not familiar with, or if they just wanted to determine how long it's going to take to get to the practice. The key thing to note there, with Reminder Manager, you have access to all 4 channels to send reminders. You don't have to sign up for individual modules or anything like that. And when patients give you responses and interact with those messages that you're sending through the different channels, you can view those results all in one place. Also, you can mix and match these. So if you had 50 reminders to send in a day, you could send 30 voice calls and 15 texts, and then maybe a combination of email and push notifications from there. Anything that you want to do, however you want to mix that up, or based on the patient's preference, is entirely possible. So just in summary here, again, the service is a cloud-based service, so you don't have any new hardware or IT components to manage, no new servers or phone lines or anything of that nature that you have to install. We also have professional voice talent on staff that will record the messages for you. Also, we do support multiple languages as well. So English and Spanish are, of course, the most common, but we do have clients out there that are using French and Russian and Mandarin Chinese. We have a third party that we work with that actually supports, I think it's 23 additional languages. So if you have a diverse patient base, we could certainly support you there as well. We talked about messaging logic and our ability to send out a customized message based on the type of appointment that the patient is coming in for, and unique messaging there. And one thing that we didn't touch on is that whenever we do send a voice call, we will actually project the caller ID information for your practice, or whatever caller information that you want to project. So as far as the patient is concerned, it's going to look like their healthcare provider is calling them. So hopefully they'll be much more likely to take that call and give you that response and that feedback that you're looking for. So those are all of the slides that I had for this presentation. Veronica, I'm not sure if you want to open the floor up for any questions. I know we've got a few minutes left here, if that's an option.
Yeah, actually, if anybody has any questions, please feel free to type in the questions. At this moment, there are no questions waiting to be answered. So, Jeff, if you have a little bit more to present, we can go there, continue. And if I see a question come through, I'll let you know.
Mm-hmm. Yeah, just some details about the service. So I give a high-level overview of just the features and functionality related to Reminder Manager. But one of the important things to note is the system is very, very flexible and highly customizable. So if there was a feature that you were hoping to hear about, or a certain application that you were hoping that a service like ours could perform that I didn't touch on, please ask, because there are a lot of unique things that we do with the service beyond just appointment reminders. Everything, from down to, as I mentioned, collections and recall-related messaging, to vaccine reminders and outreach reminders, emergency closings, anything that you could think of where traditionally someone at the practice may have had to pick up the phone and call the patient. We can usually help in automating that process. One more thing I wanted to touch on here, I don't have slides for this, but I just want to touch on our ability to send collection-related messages to patients. We can send just reminders stating that the patient has an outstanding balance, but we also have the ability to present or give the patients the option to actually make a payment over the phone. So if you wanted to, you use the service to actually allow patients to make a payment or give another layer of presentment there beyond just statements and manual calls. It's a very inexpensive way to reach out to the patient and give them that option to go ahead and pay their bill, or a portion of their bill, if you wanted to make that option available.
Okay, Jeff, we did have 2 questions come through. One question is, okay, can transport, hold on, let me make sure I'm scrolled all the way up. I apologize. Okay, Can transportation pickup times be added? You talked about combining the correspondence we have used.
So the transfer times, as in the time that the patient pressed the key to make the transfer?
No, it's talking about transportation pickup times.
Oh, I'm sorry. If you don't mind, could you read that one again? I thought you said transfer as in a call transfer. But if you mind, could you read that one again for me?
Sure. It says, can transportation pickup times be added? You talked about combining the correspondence we have used.
Mm-hmm. Certainly. So if you want to, as part of your appointment reminder, you remind a patient about the time that maybe transportation would be available, just so long as you are storing that information where we can access it. If you're storing that in your scheduling platform, or if it's in a separate platform that can be in some way connected to the schedule, so that we know, John Doe's appointment has this associated transportation time, we could certainly do that. We would just need to have access to the data about the timing for the transportation, and we could certainly key off of that and use it as part of the message. That's an interesting question. I've never heard that one before.
Okay, and I actually combined part of the sentence that goes with this question. So I apologize regarding that. Unfortunately, these questions kind of blend in together, so I have to find where to start. So here's a question. You talked about combining the correspondence. We have used ClientTell before, so I know how this works. But can we opt into doing all the correspondence?
So if I understand the question correctly there, combining versus opting in, I'm not sure that I fully understand the question, but let me try to phrase that in such a way where we're saying that if you wanted to control the different channels, you could certainly do that. So voice, text, email, and app, we could mix and match and use a combination of these 4 channels. Or if you wanted to force it and just say, hey, all of my patients should get a voice call, we could certainly do that as well. There's really no limitation to you as far as how to send the message. The only time that there would be a requirement for unique data to come from the practice is if we were using the patient's preferred method of contact. If you were capturing the preferred method of contact and you wanted us to send messages through that channel, we would just need to have that data in some way. So if you were recording that information about the John Doe's prefers to get a text message, then we would just need that data stored in your scheduling system and associated with the appointment, so that way we could key off of that. And I hope I answered your question there. And if I did not, please do. You can send an email either directly to me or through Veronica, and I can answer it outside of this meeting.
It looks like she added another part to it. It says, this is where a patient can receive a voice call and text, or voice and email.
That's right. So yeah, so if you are combining those, we could absolutely do that, and we could preset that for you, just so long as you're capturing email addresses and cell phone numbers. We could say through, let's say, for example, if we wanted to send a voice call 3 days before the appointment and then follow up with a text reminder the day before the appointment, we could certainly do something like that for you. Or instead of a text, maybe an email or any combination there.
Okay, great. Let's see a couple other. She says, thank you. Another question is, we have patients that see multiple specialists on the same day at the same facility. Can that be arranged for one call instead of multiple?
Absolutely, absolutely. So we refer to that just broadly as family merging, but it certainly could be for one specific person as well. So if you had a patient at the same location with 3 appointments, we could either combine them all just to one reminder, or in some cases we've even merged those in and reminded the patients of each specific appointment time. So there are several different ways that we can go about it, but definitely if we see appointments coming in for the same time, same day, just different, maybe different provider, then certainly we could combine those into one reminder message.
Okay, great. We don't have any other questions in the queue. If anyone has any more questions, please feel free to type those questions in so that we can get those answered. Otherwise, Jeff, do you have your phone number to display maybe on the screen, or I could just email that to everyone also to get in touch if they have any additional questions?
Yeah, just feel free to email everyone my contact information. That would work fine.
Okay, sounds good. Okay, well, this webinar was recorded, and it will be available within the next week. The slides will be available and emailed to you by tomorrow. And again, if you have any additional questions, please don't hesitate to reach out to me, Veronica, at Physician Partners, phone number 619-359-6600, and I'd be happy to help you out with your questions and connect you with Jeff Ellis or Reed Gilbert. Thank you everyone for participating in today's webinar. Thank you very much, Jeff, for your presentation, and have a wonderful day.
All right. Thanks, everyone, for your time.
Thanks. Bye-bye.